Hello, you're welcome to my platform. I am Dr.Sandra and I'm a surgeon. I help you become aware and sensitized about the different surgical conditions. Today's video is about impetigo. Impetigo is a highly contagious condition that affects the upper part of the skin, the epidermis. By the way, the skin has 3 layers. It has the uppermost part, which is called the epidermis, the second part called the dermis, and the lowermost part called the hypodermis. It is the upper part, the epidermis, that impetigo affects. The infection of the upper part of the skin, the epidermis, is commonly due to bacteria. And the commonest bacteria in 80% of the cases is a bacterium called Staphylococcus aureus. Although the group A, Streptococcus, is also implicated in 10% of the cases, and in rare cases, another bacterium called Pseudomonas aeruginosa. What happens in impetigo is a bacterium, for example, Staphylococcus aureus, can access the deeper layers of the epidermis through a breach of integrity of the epidermis. For example, it can be through a scratch, a skin rash, an insect bite, or through an already existing skin condition, for example, psoriasis, eczema, chickenpox. And so the bacterium can easily reach the deeper layers of the epidermis through these existing skin conditions. However, the bacterium, for example, Staphylococcus aureus, has the potential to reach the deeper layers of the epidermis, even when the skin is intact. For example, Staphylococcus aureus produces a toxin, a poison, called the exfoliative toxin. This toxin, or this poison, tends to separate the cells of the epidermis from one another, allowing the bacteria to go deeper into the epidermis, the upper part of the skin. The presence of the bacteria in the deeper layers of the epidermis, that is the upper part of the skin, results into a recruitment of the cells of the immune system called the neutrophils. These come in to try to fight off the bacteria. The neutrophils have some structures within them called the lysosomes. The lysosomes contain some enzymes, and once these enzymes are produced from the lysosomes, they tend to destroy the cells of the epidermis. This results into formation of swellings, for example, papules, pustules, bullae, blisters, and vesicles. Bullae are just swellings on your skin that contain clear fluid, and they are usually more than 1 centimeter in size. Blisters are also swellings that occur on your skin, and they can contain clear fluid, but sometimes they can contain blood. They vary in size, but most of the time they are about 3 centimeters, but they can also be more than 3 centimeters in size. The vesicles are also small swellings that occur on your skin, and they contain clear fluid, and their size is usually 1 centimeter or less. The papules are solid raised swellings that occur on your skin. They don't contain any fluid, and they are usually less than 1 centimeter in size, while the pustules are raised swellings on your skin, and they usually contain pus, and they are usually less than 1 centimeter in size. In impetigo, you can either have the vesicles, the bullae, and the blisters, or you can have the papules and the pustules. The vesicles, the bullae, and the blisters, or the papules and the pustules, can later join together, and eventually they can burst. And once they burst, they form a sore, and this sore or this wound is usually covered by a honey-colored crust. It is usually yellowish brown in color, like the color of honey. And this crust is usually adherent to the skin. This yellowish brown crust, or the honey-colored crust, is a telltale sign or a major sign of impetigo. Now let's talk about the different types of impetigo and their respective signs and symptoms. The first one is the non-bullous impetigo. The non-bullous impetigo presents with the papules and pustules, and it is usually as a result of Staphylococcus aureus and group A Streptococcus. The papules and the pustules eventually burst open and they form an open sore, an open wound, and this open sore is usually covered by a honey-colored crust, yellowish brown in color. After some time, the affected area will heal and there won't be any scarring because the infection is limited to the upper part of the skin, the epidermis. The second type of impetigo is the bullous impetigo. The bullous impetigo presents with the vesicles, the bullae and the blisters, and it is usually as a result of a bacterium called Staphylococcus aureus. The skin surrounding the bullae, the vesicles and the blisters is usually not reddened, so there is no associated reddening of the surrounding skin. After some time, the vesicles, the bullae and the blisters will join together and they'll eventually burst open, and this results into formation of a wound, a sore that will be covered with a honey-colored crust, yellowish brown in color. The skin of the affected area will eventually heal and there won't be any scar formation because the infection is limited to the upper part of the skin, the epidermis. The third type of impetigo is what we call the ecthymatous impetigo. Ecthymatous impetigo usually happens when the impetigo is not treated, and this results into the infection spreading into the deeper layers of the skin, for example, the dermis and the hypodermis. Ecthymatous impetigo usually presents as painful blisters on the skin, and these painful blisters eventually turn into deep sores, deep wounds, and this is because the infection has spread deeper into the deeper layers of the skin, for example, the dermis and the hypodermis, because it was left untreated. The skin surrounding these deep sores will also be reddened, and the sores will eventually be covered by a thick crust. However, in the context of ecthymatous impetigo, the affected area will heal by scar formation. This is because the infection spread deeper into the deeper layers of the skin, for example, the dermis and the hypodermis. In all the three types of impetigo, there will also be associated lymph node enlargement. The individuals that are commonly affected by impetigo include the children, especially those children between the age of 2 years and 5 years. Individuals that have pre-existing skin conditions, for example, eczema, scabies, psoriasis, individuals that have a poor personal hygiene, individuals that participate in skin-to-skin contact sports, for example, rugby, football, boxing, and wrestling, as well as individuals that live in overcrowded environments. The parts of the body that are commonly affected by impetigo include the face, and usually when it affects the face, it usually starts with the mouth and the nose. It can also affect the ears, the hairline, and the scalp. Impetigo can also affect other areas of the body, for example, the upper limbs and the lower limbs, especially the legs and the arms. Impetigo is a highly infectious condition, highly contagious condition, and so it is important for you to know how it can spread from one person to another. Most individuals get it through skin-to-skin contact. One can get impetigo by coming into contact with the sores of the affected individuals or the body fluids, for example, mucus. The other way is through sharing personal items, for example, clothing, towels, and other personal items with the affected individual. The complications of impetigo include glomerulonephritis. Glomerulonephritis is when the small filters within the kidneys that help to filter blood and convert it into urine get inflamed. They can get irritated and get destroyed. The other complication is the infection can spread deeper into the deeper layers of the skin, for example, the dermis and the hypodermis. The other complication is the infection can spread to other parts of the body, and this can be through blood. Impetigo can as well cause permanent scarring, especially if the infection spreads deeper into the deeper layers of the skin, for example, the dermis and the hypodermis. The diagnosis of impetigo is essentially clinical, so we do history taking and clinical examination. However, we can carry out some investigations, and this can help us manage the patient better. For example, we can do culture and sensitivity, where we take off a sample of the pus and we can find out the bacteria that is causing the impetigo, such that we can tailor our medications to that. When it comes to the treatment of impetigo, we can employ topical antibiotics, for example, mupirocin, and this is usually used in the context of localized impetigo, when the infection only is limited to a small part of the body. We can also employ oral antibiotics or IV antibiotics. For example, the penicillins like dicloxacillin, flucloxacillin, cloxacillin, and the cephalosporins, for example, cephalexin. These are usually employed when the impetigo covers a large area of the body. When it comes to the prevention of impetigo, please exercise good personal hygiene, and this includes regular washing of your hands with soap and water or using an alcohol-based hand rub. Please also shower daily. Please also clip your nails as well as those of your children. This can prevent accidental scratching of the skin and improve overall personal hygiene. Please also avoid scratching wounds or any pre-existing skin conditions, for example, psoriasis and eczema. This is because when you scratch the wound or any pre-existing skin conditions, you can easily introduce the Staphylococcus aureus, the bacteria, into the deeper layers of the skin. Please also avoid trauma to your body. And if you ever sustain any trauma to your body, please show up to the hospital such that the wounds can get cleaned. This can help reduce the amount of bacteria in the wound. Please also keep your linen clean, for example, your beddings, your clothing, your towels, and your undergarments. For individuals that are suffering from impetigo, please avoid touching the affected area with your bare hands. And if you ever accidentally touch the affected areas with your bare hands, please avoid touching any other surfaces, and please wash your hands immediately with soap and water. This can help prevent the transmission of the infection to other individuals. That is what I had for you. Thank you so much for watching. Please share my videos and also subscribe. See you in my next video. Bye.